As measure to cushion the effect of the COVID-19 pandemic lockdown, an NGO had taken it upon itself to show some love to mentally challenged patients in General Hospital Agbor and Federal Medical Center Asaba, Delta State. The outreach took off on Wednesday, 6th May 2020 at Central Hospital Agbor, where members led by the Secretary Board of Trustees of the NGO, African Foundation for Mental Health Advocacy, Mr. Victor Daniel. The exercise outlined for the outreach is counseling of the mental health patients, distributing palliatives such as cash gifts, soft drinks, and also paying for the drugs that was prescribed for each of them. Speaking with our PMTV correspondent, Dr. Michael Nwadioku charged those with loved ones having mental health issues not to hesitate in bringing them to the hospital, assuring that they can be properly managed, adding that mental health illness is not a life sentence.
They usually come around to help mental health patients, to encourage them and to let them know that there's no point stigmatizing anybody that is mentally ill. And I would like them, anybody that's maybe if you have a relative or a friend that is mentally ill, you should come to the hospital and they'll be properly managed. Also a rehabilitation center that once they're properly managed, they can be there too. So it's not a life sentence mental health disorder as it were. It can be managed. They should come with follow-up, because once you are treated, for example, for like 2 weeks, if you're not consistent with medication, there will be a relapse. So once they are consistent with medication, they can be fine.
The health assistant to Dr. Munu, Mrs. Oyensom Comfort, advised against stigmatization. She pleaded with patients on the need to always meet up with the doctor's appointment date, as she thanked the NGO.
I'm seizing this opportunity to thank the public. If you come across anyone who is mentally sick, do not stigmatize them. Don't make him or her feel ashamed. Bring the fellow to the hospital. There is no sickness God cannot cure. Doctors here are well trained. They know the drugs. My boss, Dr. Mono, is really trying. God has used him to heal so many people. They bring them in critical condition. When they finish treating them, they get better. I'm also using this opportunity to advise the patients that as Dr. Muno is giving you drugs and giving you date of next appointment, don't miss it. Always come to see your doctor and always take your drugs, because when you fail to take your drug, it might increase the problem. I'm also using this opportunity to thank the members of the NGO for acknowledging the fact that the mental health patients cannot fend for themselves. Neither can they make ends meet because of their health challenge. God is going to bless your organization. Backward never, forward ever will your organization keep going, in the mighty name of Jesus.
The day 2 of the NGO's outreach was at the Federal Medical Center FMC Asaba, where Mr. Victor Daniel led his group to the mental health unit for continuation of the support exercise. Speaking with a mental health physician, Anthony Enebe, he pointed out barriers that hinder some patients from coming for medical attention, as he outlined some advantages of going to the doctor.
A lot of people are not accessing mental health care because of stigma, because of a result of the feel there's not affordable, but there are some advantages of coming to the hospital to access mental health care. It prevents you from having a lot of conflict with your family members, prevents you from having conflict in your employment, prevents you from having conflict with the law. It also helps to prevent you from substance abuse and the sequelae of substance abuse, especially the other physical complications and more mental health problems. So there are a lot of advantages for ensuring that you access healthcare in mental health care in the hospitals. They feel that there are a lot of issues concerning coming to the hospitals without having money. That mental health care is a bit expensive. That mental health care is not, there's not enough manpower. There are not enough mental health policies that allow people to access mental health care. But these things are being worked on as we speak, especially trying to make it as affordable as possible. A lot of non-governmental organizations also are giving a lot of support to mental health service providers so that they can be accessible to a lot of the populace in the country. We always tell you, continue to come for your checkup. adhere strictly to the medications, comply with your drugs and what the advice your doctor has given to you. If you observe that, oh, you have some complaints whatsoever, you come back. That's why we keep seeing our clients repeatedly on either could be a 2-week basis, monthly basis, 2 monthly, 3 monthly, depending on your response. So I would advise that those who are not experiencing a lot of improvement as they go to always come back and inform your doctor.
A consultant and medical expert in the unit, Dr. Israel Adagu, emphasized on awareness on mental health and how it can be managed.
People attribute mental health illness to spirituality and religious issues. They are not aware of the WHO definition that health is not just about physical health. Health is both physical, mental, and social well-being, and mental health covers the mental and the social aspect of health. So once people are educated enough, enlightened enough about mental health being an aspect of health, they will begin to take it serious. They will begin to watch out for the signs and symptoms, and then they will come for help. And then secondly, there is help for those who are mentally challenged. It may not be as fast as the treatment for malaria and other acute illness. Mental health is a chronic illness most times, just like we have for hypertension and diabetes. But people get well. When they make themselves available for help, they get help and they recover, from my experience. Like you said, when people cannot go out to work, they are not sure of what they will eat, and then some are already losing their job. This will constitute psychostressors and major life events. And that's why I believe in the team, both at the federal level and the state level, handling the mental COVID-19 prevention and management. We have a team of mental health experts among them who watch out for those who will break down, who will come down with crisis, and then palliative should be extended to them. I was quite happy when I went to my own home community and they said they were targeting vulnerable people for palliatives, and mental health ill patients are vulnerable people. This NGO has always been there to assist those who have mental health issues and challenges. They've looked out for people who cannot buy their drugs or afford to access mental health facilities and assist them in any way they can. Today again now they have come. They are providing treatment for at least 10 patients in the outpatient clinic of mental health. They are buying the drugs for them. We appreciate them, and we encourage that other NGOs and other Nigerians should follow same pathway to assist. This will encourage them. This will also make them feel wanted, and it will encourage them to take their treatment when and as due.
This is where they cure mental health patients, not just to cure them, but we also explain to them the function of the brain in the body, not because the situation is so critical that makes them come here. There are some people that comes for counseling, and some who don't really understand their body come for inquiries to know what is going on with their body. That's why we are here. The question you ask is very good and important. There is what we call stigmatization in English. It means when some persons sees anyone who is mentally challenged, mental health patient, they begin to avoid them. They start running away from them because it's not well treated. That's why it's beginning to manifest inside of them. So we are using this opportunity to tell them that this sickness cannot be transmitted from one person to the other, but sometimes it can be transferred from parents to child. That's why it's good if you want to get married, you have to be very watchful, not something you rush into. By doing so, not helping yourself, and you are not helping us either. When you start seeking solution for it earlier, the better. A sickness well diagnosed is half treated. When it has been diagnosed, the issue is already being addressed. Next time when they are talking of the sickness, it's not going to be much of a big deal because they already know what the problem is. We have to secure ourselves. If you are having any of these challenges, either sickness, you are given instruction, make sure you follow it. And whichever the government requests you should do, you do it. It's very important. It's been announced in churches, also in mosques. Do you understand? And if you understand it, follow the rules, you work with it. Your mind tells you it's going to work for you, it will work for you. But when you keep thinking negatively, it is true. Some people are running away from their wives, some are running away from their husband, and they are having breakdown from the sickness. You see it in some families. Some eat very well, while some others, they are finding it difficult to feed. He might just be suffering from depression. That's the kind of sickness that will keep him dumbfounded. He can't talk anymore. All he thinks about is for him to either kill himself or kill somebody. We are appealing to everybody. If there's any symptom you are feeling in your body you don't understand, go to the hospital. Hospital is better. It's a hospital that will tell you and explain properly to you what is wrong with you. And if it has to do with mental health illness, quickly bring them here to our hospital with a referral. We take it up from there and follow it up. Then the person will be free from the sickness. On behalf of the staff and management of this hospital, we are saying thank you so much. The NGO are making payments for your drugs. They also brought female drinks. Thank you so much to them. This awareness and initiative they brought is highly welcome. Thanks to them. And also the media that came with them, we are thanking you for the way you are working with the NGO. Please don't leave them. Keep it up. The Lord will reward you all in Jesus' name.
Victor Daniel highlights the mandate of the NGO and thanked donors for their magnanimity in caring for the patients, not leaving PMTV behind, as he also appreciates their support.
My NGO is here to give palliative for mental health patients. We are doing it across several hospitals in the country, and Federal Medical Center Asaba is one of them. Yesterday we were in Central Hospital Agbor for the same outreach. We gave counseling and wellness materials, and then we paid for patients their medication. So we did that for all the patients that came to Central Hospital yesterday, and today we have done for FMC Asaba for indigent patients. I'd like to thank the donors for their sacrificial and loving heart that gave magnanimously for what we are using to take care of mental health patients. I also want to thank PMTV for covering this, and Fables and Mind that presented their awareness materials. All other individuals, too numerous to mention.
And finally, what do you have to say to friends and loved ones that have mental health patients?
I want you to believe that one can recover from it. I was once a victim. I am a survivor. I went through clinical depression. I was managed in Central Hospital Agbor, and today I have an NGO of mental health. I've written books on mental health. If I can make it, you can overcome.
Loved ones of some beneficiaries who spoke off camera thanked the African Foundation for Mental Health Advocacy and its donors. From Federal Medical Center Asaba, Chinoinim Kennedy, PMTV News.